Hey Kyle,
Hello,
how are you?
I'm fine. How are you doing?
I'm doing good. So the doc isn't here today. We'll be alone. We'll be doing this. So this is your first experience here, right? On the podcast.
Yeah, it's my first experience, and I'm thrilled
Thrilled.
to.
So no, not nervous at all. Nothing.
No embarrassment at all. Yeah, we will discuss. The topic is frontotemporal dementia, so we'll just discuss with each other, and
I think it's pretty
we'll,
self-explanatory because frontal temporal lobe,
yeah,
that is like the part of the brain, dementia.
yeah.
So let's just get
So
started.
should we start?
Yeah, I think we should start.
So of course, with everything, we are gonna take help with ChatGPT.
Savior.
So first of all, I think most people know what dementia is,
Yeah.
but
It's
but yeah, yeah.
for those who do not know, it's basically the loss of thinking or like ability to like make decisions.
Yeah.
So you can explain the frontal temporal and how the brain works with that.
So basically, yeah, dementia is a collection of symptoms. It is not single symptom. It is collection of symptoms,
Right.
like memory loss, loss of ability to think, loss of ability to feel, like all these kind of symptoms. When they get together, it comprises dementia. So we are talking about we today we are talking about a very specific kind of dementia. First of all, I would tell that we characterize the brain in four different regions: frontal
Right.
region, parietal region, temporal regions. Like there are two temporal regions on both sides of your heads, and
Right.
an occipital region. We are talking about frontotemporal region, and to give you an idea, frontal and temporal regions of the brain deal with different kind of frontal region deals with the cognitive abilities of a person, while temporal region deals with the emotional intelligence and language comprehension.
Right.
So, so when any kind of damage due to any genetic cause or some other reasons like trauma, when damage happens to these regions, these functions are affected, like language comprehension or emotional intelligence or cognitive abilities, problem solving, thinking abilities. But to talk about it in detail, we'll just see what ChatGPT has to say about it.
I mean, we do see like a lot of, in real life, we do see like kids who actually do not have like, very fluent kind of speaking skills. They do kind of, get stuck in between. So this is basically that, right?
There can be many reasons. Uh, if they are not so fluent in their languages, maybe because they haven't developed that skill very efficiently. But yes, the trauma can also be the cause of it.
Right. Trauma is obviously a cause of it. Let's see.
So, what ChatGPT says about it is that frontotemporal lobe dementia is a group of brain disorders caused by degeneration of the frontal and temporal lobes of the brain. Now, degeneration can happen due to trauma, due to genetic cause, like there can be any genetic abnormalities.
Yeah, it could be an injury as
So,
well, emotional trauma.
yes. So what happens in frontotemporal dementia in this condition? Neurons in frontal and temporal lobes gradually die. So these areas normally control, like I told you before, that these areas normally control judgment, personality, social behavior, decision making, language, and emotional understanding. So
Right.
as they degenerate, these are all the characteristics which get affected. Now
I
there
mean,
are
because
some.
it affects your emotional understanding, right? So I think if there is this symptom, it becomes more it appears more in your like let's say how you act. So I think that will also lead to some more disorders or more um it will
Exactly,
make you
more.
think different.
Yeah,
Because the
yeah,
thing is like if an emotional understanding your emotional understanding is being affected, that could be that you are not being very, let's say, understanding. You're being more spiteful at times. You're being overly sensitive at times. That could be, it could lead, make you feel like you might be bipolar, borderline personality disorder. So I think maybe it might
Exactly.
have a link.
You like you enter into a vicious cycle where a symptom, whatever the cause was,
Mm-hmm.
developed, and then you just went into the vicious cycle where one symptom led to the other, and things start getting worse.
Right.
So there are some types of frontotemporal dementia. Like I said, we will divide it into two regions. First, we will talk about frontal region. What happens when the frontal region is affected? So, like I said, that frontal region deals with the cognitive abilities. So, when the frontal region will be affected, there will be the personality changes. Like a person will become rude, impulsive, or just like you said, that one symptom will lead to another symptom.
Yeah.
And have you seen those kind of people who are very nice, but they suddenly turn toxic, turn
Yeah.
into the toxic person, and they start behaving
Yeah,
rudely?
they are so bipolar. Like they're one thing at one time, and then they like completely switch up like the next second.
Yeah, and then they develop this obsession with any kind of thing. They become compulsive. Obsessive compulsive disorder is what is called.
Right. Yeah. OCD.
So, if we talk about behavioral variant of frontotemporal dementia, it is the most common type. Like from the three types, it is the most common type of frontotemporal dementia, and the symptoms which include in these are personality changes. Person becomes rude, impulsive, or emotionally flat. He he develops the loss of empathy or social awareness. He
Oh,
develops lack of motivation, so it will lead to depression as well.
if they have like lack of motivation, lack of empathy, social awareness, that like we talked about like being bipolar, right? So these symptoms, they kind of hint towards sociopathy, psychopathy in a way, like maybe more low key, but towards those symptoms.
Yeah, yeah, exactly. And then, as I told you before, that they will become compulsive. They will develop these repetitive behaviors, and judgment skill will be their judgment will be affected. So they will develop this poor judgment, or socially they will start acting socially inappropriate. They will become like, have you seen those introverted personalities who are so awkward in the social situations?
Yeah, I mean, I used to have this friend who used to be like, kind of ashamed or, embarrassed of eating in a public crowd. So
Yeah,
that I used to find like very insane in a way, like that why that happened. So like reading this, that this makes a lot of sense that it really messes with them emotionally.
exactly. And I had a professor of mine who had OCD regarding hygiene.
Oh, right.
He didn't even used to shake. He didn't shake hands with anyone. So he was that kind of. He was suffering from severe OCD, I would say. But there can be some, like, many reasons behind that. It is
I
not
mean,
only frontotemporal
we all
dementia.
accuse our mothers of having OCD, to be honest.
Yeah, maybe. So the second type, if we talk about it, is primary progressive aphasia. It affects language. So language is supervised by the temporal region. So if the temporal region is affected, then the language comprehension and language skills are affected. And again, it has two other forms as well. Non-fluent agrammatic type, where speech becomes slow and effortful, grammar breaks down, like you cannot speak fluently. Uh, there can be the reasons like you don't know the language well enough, but if it is your mother language and you are not speaking so fluently, then this might be the cause.
Oh,
Frontotemporal dementia might be the culprit behind it. And Other form of primary progressive aphasia is semantic variant, where a person forgets meaning of words and objects. Now, we as students, we have this tendency to forget about things, but
Yeah,
if
true.
yeah, so we cannot always blame frontal temporal dementia for that, but but if like we can if we start focusing more, and if we start giving more time to our studies, we can compensate that. But if we have damage in our brain, then nothing will improve. Like whatever effort we put, it will not improve. So that's the difference, which is between normally and like when we normally forget about the things, or when there is some kind of damage in your brain.
So semantic variant is basically like the error, maybe not an error, but like you're not able to like comprehend the content of the language itself. And then agrammatic type is basically trouble in delivering the language, right? So this is the difference between the two.
Yes. So in one, you are not fluent in that language, and in other form, you are just unable to comprehend whatever is being said to you.
Yeah, makes sense.
So the example which ChatGPT gives is that the person may say, "Give me that thing," unable to recall the name pen. Like simple things, you cannot even recall the names of the simple things around you,
Oh, right.
and that must be very depressing. I mean,
Yeah, to be honest.
and third type of frontotemporal dementia is frontotemporal dementia with motor neuron disease. Combination of
Mm.
behavioral or language symptoms plus muscle weakness, wasting, or fasciculation. So the types we have seen up till now, there were no other symptoms than the behavioral or intellect, like related to the intellect or cognitive abilities. But in this type, other symptoms develop as well, like your body faces muscle weakness, muscle wasting, or muscle fasciculations, as is seen in like you have talked about this syndrome with Dr. Reed, like right,
Uh-huh.
ALS. You were having discussion with him where the body
Right.
loses this ability to use muscles or
Yes, exactly. Yeah, yeah, yeah. I do remember it.
so. If frontotemporal dementia is with motor neuron disease, then you just lose your ability to use muscles, and muscle weakness, wasting, or fasciculations are developed.
Makes sense. This is something new compared to what we have already done.
Yeah, so now if we talk about the causes and pathology of like why it happens and how it happens, then genetic mutations cause up to 40% of
Oh, wow.
cases. So almost almost all like 50 but almost 50% of the cases are caused by genetic mutations. Others are of
Mhm.
course trauma and like other
So it's
food.
not basically genetic inherited. So mutation, that means it happened after a genetic change was caused already.
Yeah, exactly. And now it tells about different kinds of genes which are culprit behind it. Where it is tau protein, MAPT, progranulin. We will just ask ChatGPT to explain to describe more about these genes and their roles in this pathology. But right now
Right.
we will just go through it.
Mm-hmm.
Other gene is GRN, which is also called progranulin, and C9orf72 repeat expansion. Pathological proteins are tau, TDP, 43, or FUS that may accumulate in neurons. And when any foreign object accumulate in neurons, neurons get damaged and thus lose the ability to perform their normal functioning.
We have diagnosis.
So how can we diagnose this? Like if we are experiencing these kind of symptoms, what can we do? We can obviously reach to the medical professional, and he will tell us to go through MRI or CT scan.
Mm-hmm.
In MRI or CT scan, there will be frontal or anterior temporal lobe atrophy. Now, we should show these atrophies. Let me search on the Google
Right, of course.
because this is important. MRI. Let me share this other screen. Can you see it? Wait, wait,
Not yet.
wait.
Oh yeah, we can. Yeah.
So here these hypodense areas, like hypodense mean that those areas which are less dense than the normal brain area. This is the normal brain tissue. This
Right.
the grayish portion you are seeing. This is normal brain tissue. These are ventricles, but we are not talking about them right now. So these hypodense areas, they indicate that there is some kind of neuronal damage or atrophy going on in the brain. So,
Oh, yeah.
so if we are experiencing these kind of symptoms and then we go through CT scan and we see these atrophic changes in the brain, then we can confirm it then that we are, and this is the temporal region. So we can confirm it that it is frontotemporal dementia that the person is experiencing.
Right.
So we should get back. So other ways of diagnosing this disease is that we can go through neuropsychological testing.
Mm-hmm.
Okay,
Oh,
so
so it's your physical like testing if you can speak well, your memory, all those functions.
yes, you will be told something, and then they will assess that if you can comprehend it, if you can memorize it, if your cognitive abilities are intact or not.
Right. Okay.
And then there is another genetic testing, which is not very common in our culture, but it is in other parts of the world. So genetic testing will obviously it will be confirming the diagnosis of frontotemporal dementia.
Mm-hmm. Right.
Now, how can we treat this? Unfortunately, there is no cure yet.
Uh,
We can do nothing about it. So management focuses on symptom control. So in medical sciences, if we don't know the definitive treatment of any disease, we treat the patient symptomatically. Whatever symptoms appear, we try to treat those symptoms so that the person can have the normal functioning of life.
so it's like an indirect treatment of the disease.
Yeah, it is not actually a treatment of disease. It is treatment of the symptoms. You
Right.
will
But
not be
yeah,
cured.
yeah, but we're like, trying to like treat the symptoms. So it will indirectly, lower down the disease or maybe treat it in a way.
Yeah, so you will not be cured, but you can slow down the progression
Mm-hmm.
in some kind of disease. You can either slow down the progression or you can just alleviate the symptoms. These
Uh-huh.
are two options that you have when you cannot cure the disease as a whole. So what do we do in this case is that when there are behavioral symptoms like the loss of memory or apathy, or depression, we just gave them serotonin reuptake inhibitors or antipsychotics. So these are basically fancy names of antidepressants. Yeah. So the compulsive acts we talked about, OCD, these SSRIs will treat the OCD in the person. And for aphasia, we will go through the speech therapy.
There'll be a support for caregivers.
For so in these kind of diseases, we also have to counsel the caregivers and we have to counsel the family as well that they shouldn't put extra strain on the person experiencing these kind of symptoms because in that case it will worsen and it will not help him or it will not help the patient. In fact, instead it will worsen it, make it worse. So what is the prognosis? Now you know about prognosis, what prognosis is.
No, I don't know.
The prognosis of a disease is where we guess that what is the percentage that the person might like we guess the how I tell you about this. Let
Take your
me
time.
yeah. So basically in prognosis we have this intelligent guess about the progression of the disease, like at what rate it will progress. And
Oh,
yeah, so in this case, frontotemporal dementia, the prognosis is slow, like it is not worse, it is moderate, and it slowly progresses over 6 to 10 years. So it takes 6 to 10 years to progress into something worse.
that takes like a lot of time to really show what it is.
Yeah, yeah. So memory is often preserved early, unlike Alzheimer's. In Alzheimer's, you know that memory starts getting worse with time. But in this case, in this disease, memory is often preserved early.
Oh,
Yeah. So the patient, we can say patient from the memory loss. But what happens in later stages, there are severe language, behavioral, and motor decline. Like when the disease will progress and after like 6 to 10 years the patient will be experiencing severe language issues and severe behavioral issues. He will get more toxic, he will get more rude. We shouldn't say toxic because that has a different connotation to it. So the patient becomes more rude, patient becomes more compulsive, and the muscle weakness, muscle paralysis, it progresses as well.
so these are some symptoms you're like kind of bound to see in that person.
Yeah. So then ChatGPT compares frontotemporal dementia with Alzheimer's disease because many symptoms correlate in both of the diseases.
Uh huh.
So how we will differentiate between Alzheimer's disease and frontal dementia? Those MRI, CT scans I showed, atrophic changes will be same in both of the diseases. So how can we differentiate? That's what ChatGPT is showing. So early symptom in frontotemporal dementia is personality or language change, while in Alzheimer's disease it is memory loss.
Also, it's more
So
direct.
yeah, so if it is focused on memory issues, then it is Alzheimer's disease, and if it is more focused on personality or language changes, then it is frontotemporal dementia. Age of onset, we know that Alzheimer is a old age disease. So if a person is experiencing memory loss like after 65 years, so the chances are that he's having Alzheimer's disease, and
Right.
if he's experiencing these symptoms in like time span of 40 to 65 years, then it is most probably frontotemporal dementia. Yeah. So we talked about memory that in Alzheimer's it is impaired early, while in frontotemporal dementia it is
It's
relatively preserved.
preserved.
So yeah, it is not preserved totally; it is relatively preserved. In Alzheimer's disease, yeah, so it in Alzheimer's disease it gets worsened with time, but in frontotemporal dementia it relatively gets preserved. and we do not face so much difficulty regarding memorizing things. If we talk about behavioral differences between these two diseases, frontotemporal dementia and Alzheimer's disease, then in frontotemporal dementia, there is disinhibition and apathy. Disinhibition will lead to compulsive, obsessive compulsive disorder, and apathy. We all know that the person will lose ability to understand other people's point of view. He will lose
Yeah,
this
their
cognitive
emotions.
ability. Yeah, but in Alzheimer's, behaviors are normally they remain same. They do not change much. In Alzheimer, the focus is mainly on memory loss, while in frontotemporal dementia, overall personality changes.
Oh, so it's a mix of everything.
Yeah.
I think that's
So
good for today.
yeah, I think that's good.
Yeah. So let's just end the live now. Okay, so you did a great job. So
I tried.
for your first, yeah.
Yeah.
Okay, so let's just end the stream now.
Yeah. Sure.